Today what we're going to talk about are the different looks that our patients come in. They bring to us their mood boards, or they bring to us photographs of individuals on social media that they say, I want to look like this. So it creates a little bit of a challenge, but it's also very exciting for them to come to us and say, I want to look like this. So we're going to pick a couple of looks today and talk about how we help them achieve that. First is the bombshell, that really overdone look. Next is the sophisticate, a very highbrow, elevated expression. And then the purist, which is probably our biggest group of individuals. So let's talk first about the bombshell. What are the things that you're looking at to help them achieve that goal?
I would say the two big things for bombshell, when I think of bombshell, would be lips and cheeks, kind of really enunciating the cheek area as well as giving them a full lip, as long as it's an appropriate thing for that patient. We always try to make things realistic, that we don't want to take your anatomy and distort it and look unnatural, but we can still enhance different features, including that kind of bombshell look.
I agree. They're looking to be over accentuated, and that's the cheek, the high cheek, as well as very voluminous lips. So break it down to the neuromodulators and the fillers. What would you do for each?
So definitely when we're talking bombshell, typically they want a more frozen look to their face, probably, maybe even a little bit more of an arched brow. That could be kind of focusing more on the corrugator and procerus to kind of elevate the brow area, and then cheek-wise, kind of filling in that area more lateral to give them a little bit more of a cheeky look or more definition out there, and then just safely adding more volume to the lips, still only starting with about a syringe.
Share with our audience, what is it that you're doing to those lips to make them voluptuous?
So again, depends on the patient's anatomy, what they're looking for. When I think of a bombshell or more voluptuous lip, we're adding more to the bottom and then more into that cupid's bow or central area of the top lip to give them almost like a pouty look.
You're really creating true definition, and that term, if people don't understand what it is anatomically, they get it when you say pouty.
Yes, I would agree.
So you're there with a needle. What is it that you're doing? Describe some of the little maneuvers that you're doing to give somebody a pouty lip.
So again, focusing on the cupid's bow as well as kind of that lower lip. I like to use actually even the BD syringes, so like a little Botox needle to give me a little bit more precision when I'm kind of focusing on those areas. And then even adding a little bit of filler to the vermilion border or the outline of the lip to give them that definition.
Is this something that you can do all at once, or do you ask patients, let me start here and then come back in a week or two to give them that little extra touch-up?
Answer, it depends. I would do both. If a patient has the budget to kind of do it all at once, amazing. It's easier, one downtime, kind of getting it done all at once. Do I have to see patients back every 2 weeks or after 2 weeks? Not necessarily, but if they wanted to kind of do it in a more gradual process, that's definitely possible too.
And then I love what you were talking about the cheeks. And these products are called fillers. They're not called lifters. And so describe how many cc's of volume you might be filling their cheeks with.
Again, very patient dependent, but you could start with anywhere from 2 to 6 syringes of just cheek filler and still not get that like pillow puffy face look. But we're really good about starting where the patient's at too, in terms of budget and their comfort level, especially if they're newer to the filler game. I would say if we're looking for more kind of definition, starting more laterally in the cheek area. And then if we're looking to restore volume in the mid-cheek, kind of giving patients more of that apple look. So putting it more medially or more in the middle.
So for a bombshell, we're looking at effectively building up those malar bones, the zygomatic bone, which they may have been losing through osteoporosis. And so this is a rejuvenative treatment to give them back that natural volume, because really the term beauty is skin deep is not right. Beauty is bone deep. And if you're losing that bony volume there from osteoporosis and you want to get that bombshell look, you need volume.
Yeah, absolutely.
So let's switch over to this sophisticate. We are in Bryn Mawr, which is really the heart of the main line. And so we have a lot of patients who come in and they are very elevated in their expression and in their demeanor. And what they're looking for is a very sophisticate look. So what is it that you're helping them to achieve?
I would say it's almost like a more refreshed version of yourself. And for me, I think of like the working woman or man, kind of the woman who or man who is professional, kind of just wants to look put together. So I do think of cheeks again, maybe a little bit of a softer approach, not as much volume in that area. And then I do think of like a nice layer of toxin or neurotoxin all over the face versus kind of just in the forehead. If we're doing like a lip or lower area of the face, just a more subtle approach to it, not quite as like in your face.
A sophisticate is more chic and less overtly sexy, which is really the bombshell.
Yeah, and like a timeless look.
I love it.
I think of
an Audrey Hepburn.
Yeah, exactly. Yes.
What is it that you would do to help somebody achieve that Audrey Hepburn timeless sophisticate look?
So I do think when I think of, I mean, especially Audrey Hepburn, you think of the brows, right? So focusing on that positioning, maybe not having them quite arch as much. So we can always tame that down when we're trying to kind of give that more timeless look to things. And again, I think of just like a softer approach with fillers and lasers and injectables.
That's actually something we hadn't talked about yet, and that is some of the energy devices that we have that can improve those fine lines and wrinkles. And that's definitely a sophisticate look, is the smoothing of those. And that can come in a combination of neurotoxin, which takes away that muscle input, which can lead to a lot of those wrinkles, a little bit of volume through the filler, and then topical lasers to soften and eradicate some of those wrinkles.
Absolutely.
Let's talk about this practically. Somebody comes in, they show you their brand board photo of Audrey Hepburn, and they say, take me there. Where are you injecting the neurotoxin?
So to get different brow positions, if we're looking to kind of diminish a little bit of that eyebrow arch, because a lot of times actually too much of an arch can actually age us. If we're looking to tame that down, we're going to focus more on the frontalis muscle.
Love it.
If we're trying to bring up the brows a little bit, relieve some of that hooding of the upper lids, focusing on the corrugator and procerus area, even a little bit below the lateral brow to bring it up.
You can really tell your injector is high level if they're putting a little bit right there that takes away that orbicularis muscle that you use to squint your eyes and really lifts that tail of the brow, which is, I think, the quintessential sophisticate. How about in the mid-face region? Lots of filler or a modest amount?
Modest amount. Yeah. Again, very patient dependent, but when I think of timeless, sophisticated, it's just kind of doing subtle touches here and there to kind of enhance the look that you already have.
How about the lips?
Same, subtle. I don't think you need to go crazy with a sophisticated, timeless look and to make it chic, but a little bit of volume or hydration, especially in the summer months and things, is great for that. Hydration,
that is actually something we haven't talked about yet. Hydration is key. So this is not just what they're getting when they come in to the office and they're getting the treatment, but there are also products that we have that we can recommend or we can help them layer on top of that to improve their cheeks and their areas around their eyes by minimizing that epidermal water loss.
Yeah, well, the fillers themselves are made up of hyaluronic acid, so they pull moisture to the areas. So if I'm injecting a cheek, a lip, something like that, it's going to pull that moisture in that area too.
And what you just talked about there is extremely important. Not all fillers are the same. And we're not going to talk about here the differences of the fillers. You can read some of the recent publications we have on that. But basically, you're depending, and you should be putting your faith and trust in Julie because she has years of experience picking the right filler for you. Because as you said, and it's extremely important, some fillers draw in a lot more water. And so you can have your result here, and then 5 days later, your result may be there. And that may not be what you're after. You may be looking for a very subtle look, which is the sophisticated natural look. I loved how you phrased it. That was great. How about the jawline for the sophisticate?
I do think of a kind of a snatched or kind of tight jawline when I think of a sophisticated patient or that sophisticated look. It can be achieved either through toxin and or filler or lasers and things that we have. So kind of putting some toxin into the masseter to kind of help diminish that, giving you a more oval face or ovular face, I should say, and then kind of adding a little bit of volume to that area to give you, again, that more angular jaw, I think of as more of a sophisticated look.
I love what you just said. And just to second it, that the masseter, some patients chew, they have teeth grinding at night, and they'll come in and they'll say, why does my face look like a box? And you just put your fingers on their cheeks and have them bite down, and you just feel these giant chipmunks come out. So Botox in that area, neurotoxin in that area can be extremely helpful to help take that boxy face and give them a beautiful V shape. And then layering on top of that a filler to give them more structural support is extremely helpful.
And chin filler, I think giving you that nice angle to the face or to the jawline, adding a little bit of projection to the chin, I think is very timeless, chic, sophisticated.
I think that's an excellent sort of icing on the cake for that category. All right, let's switch to the purist.
Yeah, I like how it kind of goes gradually, right? Bombshell, you think of a lot, kind of sophisticated, the step down, and then purist, I think of, hey, Julie, or Dr. Claytor, I just really want to look like a refreshed version of myself. I want to look like I've had a nice night of sleep. Doesn't mean that we don't do anything. It's just kind of that more stepped down approach. So really soft amounts of neurotoxin, soft amounts of filler, maybe focusing on like a CO2 laser first, something like that.
Yeah, I like that. And I would submit that we see a lot of purists here.
Yes.
There is a growing population of young individuals coming in. This whole prejuvenation category, I think, fits really well into the purists. Those that are, I want to look great, but I want to maintain how great I look for as long as I can before I have to start doing, more invasive type procedures. And so I think the purists really are our younger category of patients. And as Julie said, it's really less is more.
Yes, less is more, and again, maybe starting with different approaches, starting with more of that like foundational medical grade skincare, lots of nice facials and different soft wave treatments or CO2 lasers, then kind of building on top of that with injectables, and then kind of escalating as we age.
And we should take this opportunity to share with everybody out there that we've had Soft Wave for almost a year now, and it's been fantastic, phenomenal. Our patients love it. Both Julie and Shannon are experts at it. However, we have exciting news. Today we are starting Avava, which is an amazing laser technology that instead of using the column to come down as a CO2 laser, uses basically V-beam to come in like a martini glass that has much less impact on the skin and dramatic impact deeper. So big advances are almost completely painless, super fast recovery, and for all skin types. That means very light patients, very dark patients.
Yeah, absolutely.
So again, thanks so much, Julie, for taking the time to help our awesome patient base that uses this as their resource. We touched on the bombshell, the sophisticate, and the purist, so that it really categorized the majority of our patients who come and see us, and hopefully individuals that are out there using this as a resource. Where do I want to go? Use your brand board. Come in, share with us what you're looking for so that we can help better get you right where you want to go.
Yeah, I think we just want to take your goals and make them applicable to you in a natural way and make sure that we're happy with your results.
And that you're happy with your results.
Of course.
Thanks so much.